Right, we've got lots of calls coming in, so let's get to the surgery, shall we? Let's first talk to Lisa in London. Hello, Lisa. Talk to Dr Renee.
Hello, Lisa.
Hello there.
How can I help?
What you're talking about makes me laugh. Calm me down a bit. Right.
Be
Patient
calm.
Transport. Patient transport. I know you're prime. I wondered if you know how to go about it. They are adamant that my mum must go on her own, except for my mum can't go on her own. She's got a cancer appointment, and it's either go on her own, which she can't, or never mind and just stuff it.
I know.
Do you know how to get round the bureaucracy?
Look, there are so many things wrong with patient transport, and I'm glad you've brought this up, Lisa, because it's an important point. So, for example, Kev, I don't know if you know this, but you could have an 80, 90-year-old person who's got an appointment at 3 o'clock in the afternoon, and they have to be picked up at 8 o'clock in the morning. There's no other time. And then they have to just sit in the hospital all day.
You're joking?
Waiting. No, I'm not joking at all. They're absolutely rigid in their rules. And then they have these rules that people with Alzheimer's and dementia who are at risk of getting lost or not coming back have to go on their own. And I really don't know a way around it, Lisa, but I think it's something that should be raised. The first place I would go to is PALS, if you can get through.
That, I find PALS, I don't know if they can, because the hospitals seem to be, but just speak to this one, and the transport are completely independent, and there's nothing they won't listen.
In which case, I would go to the medical director. I would phone the hospital tomorrow.
Medical director?
Yeah, ask to speak to the medical director's secretary, because you won't get the medical director. But getting the secretaries... all right. Getting the secretary is good enough, believe me. Have a good old rant at them and say that you're going to actually publicise this more, it's a disgrace, and then you might get some action.
Medical director. Brilliant. Thank you very much.
Pleasure.
Best of luck, Lisa. Thanks for calling. Lisa in London there. We'll go to Sophia in Hampshire in just a second. Question here from Emma. She sent one in. You can, by the way, if you're feeling shy, by all means, text us or WhatsApp message us, or you can WhatsApp voice note us if you like. 03444991000. This is from Emma. Hi, Dr Renee. Have you heard of just moved down now. Have you heard of Keratosis pilaris? I believe myself and more so my 11-year-old daughter have this. She has it over the tops of her legs. Is there anything you can recommend or know anything that can help? Many thanks from Sam in... It says Emma at the top, but it says many thanks from Sam in Cheshire.
So there are lots of specialised treatments for this, the names of which I'm not going to remember today, but just for people listening, this is a condition where around each one of your hair follicles you get an overbuild of keratin, and the skin gets very rough and hard, and it's quite unsightly, and it can really build up. I know that exfoliating, keeping the skin really moisturised, so using moisturisers all of the time. But what you do need, especially if you've got an 11-year-old with it, is you need to get somebody on top of it straight away. And I would ask for referral to dermatology, because they are the experts in this, and there are other treatments, and I'm sorry I can't think of them right now, but there are other treatments to try and help keep it at bay. But just say to your GP, I know what we've got, I need a referral, do it please.
OK, there you go, Emma.
I hope that helps.
There you go, Emma, or is it Sam? Sam from Cheshire. OK, I forgot. I thought it was on the phone. Right.
I thought you were blown away by my
I was so
lack of knowledge.
By the brilliance of your answer. I always am. Actually, I am quite dazzled by them sometimes. I don't understand a word you're saying, but it sounds impressive. This is the thing for me. Call Dr Renee. It's just me sitting here going, what does that word mean? What is that? That is a really long word.
I could be making it all up.
Yeah, I reckon you are. No, she's not making it up, folks. Let's go to, I promised Sophia in Hampshire, so we'll go to her. Sophia in Hampshire, talk to Dr Renee.
Hello, Dr Renee.
Hello, Sophia. How can I help?
I'm calling about my mum. Since about May of this year, she's suffered with sort of like, it first started with her sight being blurred, then like tinnitus, and she's gone through like various different stages. She's convinced that it's long COVID. At the moment, she's okay, but she's very anxious. She won't leave the house very often. She has to have my dad with her. She's 72. She's always been very fit and healthy. She's absolutely... I've seen that you recommend the nicotine patch for long COVID. but she's so neurotic that she's scared to take anything, basically.
Has she seen her GP?
She's done loads of different tests. She's done all the tests that she needs. Like, she had a full sort of like body health check very recently, which checked everything. Everything's normal. She was going to have an MRI, but then didn't go through with it because she felt like she was okay, and the doctor didn't find anything in any other sort of like areas of concern. But yeah, so she sort of.
If this is throughout her life, has she ever suffered from anxiety or panic attacks?
Yeah.
Never.
Yeah, she had postpartum depression.
But that was it.
Yeah, and
So,
we've got a history. We've got a history of mental health, like illness, within my mum's side of the family.
I guess if she was sitting in front of me or you were in my GP surgery and this is completely out of the blue and sudden, yes, of course it might be long COVID, but, you know, post-viral syndrome as it really is. But I think I'd be more concerned about, is there something going on in her head that's changing her personality slightly, causing her to be anxious?
Yeah.
So I think if you can, I would encourage her to do the MRI. Now, she might find the MRI very hard. I find MRIs very hard in terms of claustrophobia. So she might need just a sedating tablet beforehand just to calm her down a little bit. But I think that's probably quite important. And I mean, what we always have to do in GP is rule out anything more serious before we then go to the less serious. So I'd want to rule out that she's not developing a dementia or an Alzheimer's.
Yeah.
So I'd try and make...
An MRI would be able to tell you that.
Not necessarily. The MRI would be able to tell you whether there's anything in her head, if there was a tumour or something, pressing on a certain part of the brain. But the dementia... Really what she needs is a GP to do what's called a mini mental state exam, and it's quite simple. And you could probably, if you Google it's called the MMSE, mini mental state exam. If she really won't go and see a doctor and do it, you could do it with her at home. You really could.
Okay.
And she should be scoring 30 out of 30 on that, really, at 72. So if she scores very badly on that, then I would get her to see somebody about what's going on with her thought process. If the MRI and the MMSE are normal, then I think something's just pushed her over the edge in terms of trauma.
Yeah.
And I would probably try and get some talking therapies for her.
Okay, yeah, because she keeps saying also she's having trouble sleeping, and she keeps waking up with like memories of her childhood.
That's it.
Something seems to have pushed her over a cliff edge, doesn't it?
Yeah.
Sophia, how long ago did she have COVID?
Oh, she's had COVID twice. I think the last time sort of like early this year.
So she fears that it might be the effects of long COVID, does she?
Yeah, she thinks it is. She thinks it's the post-viral infection sort of thing, and that she just has to wait it out, basically.
Yeah, I mean, it's been a long time, isn't it, if it's earlier this year, I think. Has anyone around her, has she seen, because she's at that age where she might be seeing people die, or has somebody around her got a terminal diagnosis where she's starting to think about her, fallibility?
Yeah, there was one point. So my brother's mother-in-law all of a sudden got blind and couldn't see, and then all of a sudden, like, that was around the time that happened, so I think it scared her.
So maybe the brain is a very powerful thing. So maybe she's been traumatised by something like that, and she really needs somebody, a psychologist, to unpick it for her and with her.
Yeah, she's tried some therapy, and they just reverted back to her childhood, which doesn't.
Oh, I don't know. Find a different therapist. Find one who doesn't do that. Regression is a really dubious part.
And going forward.
Yeah. Try those things. Try the MRI, the MMSE, and maybe some therapy, but not someone who's going to do regression therapy.
Yeah, exactly. That's exactly what I've yeah.
Okay, good luck.
All right, Sophia, all the best to your mum as well. Thank you very much for ringing. Sophia in Hampshire. Don't forget, call Dr Renee, 0344 499 1000 with all your medical problems, all your medical questions. She's here to help. You know the drill. If you're not feeling very well, you're worried about a friend, you're having trouble with the NHS, can't get to see your GP, Dr Renee is here to help. 03444991000. Andy in Liverpool, hang on the line. We're going to go to break. We'll talk to you when we come back. Dr Renee, give us a ring with all your medical questions. 03444991000. Andy in Liverpool has been waiting patiently for some time now, so it's good to get round to him at last. Andy, thanks for waiting. Call Dr Renee. Talk to Dr Renee.
Hello, Andy.
Thank you.
Hello, Andy. How can I help?
Hello, Dr. Renee. How are you?
I'm good, thank you.
Good. What it is, I'm 66 now.
Young.
So I'm supposed to be dying at Christmas.
You're supposed to be flying at Christmas?
No, retiring.
Retiring.
Supposed to be.
Okay.
Anyway, I've been on antidepressants for many years.
Mm-hmm.
But I've had high blood pressure.
Okay.
Now, what I'm noticing is I've been on this amlodipine or...
Amlodipine.
That's the one. Yes. Now, I'm getting swollen ankles.
Yes.
Swollen legs and veins sticking out.
Okay, so amlodipine is really, really...
What's it called again?
Amlodipine.
That's an antidepressant. Yeah.
No, it's a blood pressure pill.
Oh, okay, sorry.
It's a blood pressure pill, and it's renowned for causing swollen ankles. So get it changed, Andy, honestly. As soon as I see someone with swollen ankles and amlodipine, just change it to another blood pressure tablet.
That would be great. Thank you very much for that. I can't get through to my normal, my surgery, so...
Yeah, that's what I keep saying, Andy. That's what I say. Well, give Dr Renee a call, because let's face it, no one can get through their GP.
Do you know what I would do, Andy? I just send them an email and say, look, you're on amlodipine, it's causing ankle swelling, please could they prescribe a different agent for you?
Yeah, you need something else, Andy.
All right.
Good luck with that, and good luck with your retirement. Good to talk to you, man.
Thank you.
Andy in Liverpool. Let's go to Patricia in Sheffield.
Hello, Patricia.
Hello there, Dr. Renee.
How can I help?
Well, I'm a 76-year-old lady who I felt that I couldn't walk, and it's been like that for quite a while now. And so I went to the doctors eventually. They took some bloods, and I've got a vitamin D deficiency.
Okay.
So
you and the rest of the country, Patricia.
That's the sunshine thing, isn't it?
Yeah.
Because you get it from sunshine, Patricia. I don't know if you noticed, but we don't get very much sunshine in this country.
Exactly, yeah. And I was stuck indoors for a long time. The problem was the walking. Will it improve the walking?
So what, have you got pain when you walk?
Well, I thought it was, yeah. I mean, I tighten up. I freeze up like an arthritic. And so I just hope that it would improve that.
Well, I mean, it does depend how low your vitamin D was. So hopefully your doctor's given you a super-duper dose, like 20,000 units 3 times a week or something like that?
No, 50,000 units over 6 weeks, 6 tablets.
Oh. OK, all right. So usually we give people, just for 12 weeks, we give them a massive dose to get the levels back up. But then what you must do, Patricia, is buy some vitamin D with K2. It's really important that you have it with K2 because that's what helps it absorb, and take it religiously every single day. Everybody in the UK needs a vitamin D supplement. Even if you don't think you do, you do. I use one that's a spray. You can get it in Boots. It's a brand, I think, called Better You, but there are other brands, obviously. It's vitamin D with K2. You literally spray it under your tongue once a day. It's that easy. And it is important. It's important for skin health, bone health, mood, sleep. So, yes, if your levels are really low, you may well find that once you get your vitamin D levels back up, all of that becomes much easier. I mean, there are lots of other things that affect bones and joint health as we get older, of course, as well. So always go for an anti-inflammatory diet. So cut out sugar, try and do everything, you know, from raw, cook from home, don't have processed food. There are some other supplements you can take as well, things like glucosamine, chondroitin. All of those are supposed to help. And then for the pain, turmeric and gold has some good evidence as well. So all of those things, you'll be rattling like I do when I take all my supplements every day, but they do help because as we get older, joints do suffer with wear and tear. And the other thing, obviously, being really boring, is making sure your weight's okay.
Yeah. The problem is they've given me some cocodamol, which I don't particularly want to take, but I feel I need to take them. But I was a nurse for 41 years.
So you know.
So
you know you're going to need some prunes.
What do you mean? Because they
yes.
constipate? Yeah, it causes constipation.
Yeah, the cocodamol.
Oh, I do dates, everything. You know, everything.
Dates are not good for your blood sugar, as you know. They are little bags of sugar.
Yeah.
Sorry.
You basically you can't touch anything, Patricia. It's all dangerous. It's all...
I mean, just something like... I know you're 76 and it depends on you, but does an NSAID not work for you with something to protect your tummy rather than cocodamol so you don't get constipated and need dates?
Well, I had the ibuprofen and I felt that wasn't, you know, because I was stuck, I just couldn't move. And the doctor said, well, really, it's the last resort, it's the cocodamol.
OK, I mean, look, hopefully you won't need the painkillers longer term, and actually you could try the turmeric for pain. And also taking a good probiotic to stop the inflammatory cytokines leaking from your gut. I take Simprove every day for that reason.
Simprove, right, yeah. I also have diverticulitis disease.
OK, so you really need to be careful with cocodamol. I wouldn't let you have cocodamol with diverticulitis.
What's diverticulitis?
That's little outpouchings from the bowel that we get as we get older. It's a gut thing. Yeah. Constipation actually makes you more prone to it, and constipation makes it worse. So I would leave the cocodamol alone with diverticulitis.
Right. Thank you.
All right, Patricia, you look after yourself.
It's complex, this medicine.
It really is. It really is. Thank you for calling. Stay in touch. That's Patricia in Sheffield. And we've got time now to talk to James in Coventry. Hello, James. Talk to Dr Renee.
Hello,
Hi,
James.
Doctor.
Hi. How can I help?
For most of my life, I've been had bad insomnia. But I think that was to do with my job, because my job that I did was you had to work 2 or 3 days in a row, non-stop, before you could get any sleep. So I became immune to that. It was just one of them things. But I'm almost 60 now. But I was going away last year, and to travel I had to take that COVID jab. I don't take flu jabs or any jabs like that. If I get a cold, I just weather it out. But since I've taken that, about 4 months after that, I just keep sleeping.
Lost my sound.
And my eyes are very sore. I went at an eye test. They told me I've got dry eyes, and they gave me a liquid, and they said I've got to take that for the rest of my life. But I just keep sleeping, and I've never been like that. Never.
OK. I mean, that's unusual, obviously, and it's not... As a GP, I normally hear the opposite, that people can't sleep. Are you working now?
No, I'm not working now, but you know, I just get. I'm more tired than what I was before. Like last year. Last year, I 58, 57. I could still fly around and do things, and I had energy. But now I'm not working. I'm just sleeping all the time, just constantly sleeping.
OK, so I think the first thing, have you had any blood tests?
Yeah, I had an MRI test about where you go through that machine for about an hour, and they done all tests on me, all the blood tests, and they said the only thing I've got missing in my blood cells was a white blood cell. That's it. That's the only thing.
OK.
Was a white blood cell.
But they checked that your thyroid was working OK, because that can make your eyes dry and make you sleepy. That's what I'm thinking about. So it might be worth just checking up that they did do your thyroid and see what that was like. You want to make sure that your iron isn't too low. And if your iron is low, because you're a man, we want to know why it's too low, because that can signal something going on underneath. And I'm wondering about your mood. How's your mood?
I just get agitated. I just get agitated when I listen to people. My mood I get really bad mood swings. A lot of things annoy me. They really affect me. When I hear something, it just plays on my mind all the time.
Yeah, I asked that because you've stopped working now, and sometimes people slip into this situation where they're quite low in mood and quite depressed after stopping work. And we do know that some people, when their mood is low, they either oversleep or they undersleep. And so that's the only other thing that I can think of if they've done all of the bloods. I really can. So I would check that they've done your thyroid and your iron just to make sure.
Yeah, they done. Well, I went to can't remember the clinic I went to, but they were doing small tests. They would send me in and do a test for this and a test for that, and in the end, I just said, look, can you just do one test on my whole body, everything, instead of me just keep coming in and doing a test.
It's a good point.
So they did. They done a test on
the whole thing. Yeah.
Tropical. Yeah. I went through tropical disease test and all that, and they just done one whole test for my whole body, and the only thing they could find was a white blood cell. I was missing a white. That's the only thing. They said apart from that, everything's okay. I did have an operation on my eye about 5 years ago. I got melanoma cancer on my right eye, so they had to cut all that out.
Yeah.
So yeah, because that right eye, when they cut the cancer, it was right next to the tear duct, and if I was watching something for too long, it would start dripping water like I was crying.
Yeah.
And I wasn't crying. It was just leaking water.
Well, no, so ironically, it's a really ironic thing that people often hear and don't understand, that when you have dry eyes, your eyes overwater because they're trying to compensate. So that's quite common. Look, I think never assume that people have done the right tests. So I would specifically ask the question, did you check my thyroid and my iron? But after that, I'm out of suggestions, I'm afraid.
Oh, I'll go back in and ask them to do it. But I think they did do it before they done it, all the tests, you know.
Never assume.
Yeah, I'd go back if I were you, James, because you're obviously not feeling quite right now, so you can't be too careful, yeah?
Okay.
Good luck, James.
All right, James, all the best, mate. You look after yourself. That's James in Coventry. We've got a few more calls for after the break. We better go to break now and listen to these messages. We'll be back with Call Dr Renee in just a little while. Welcome back. Still Call Dr Renee, where Dr Renee Hoenderkamp, GP extraordinaire, answers all your medical questions. Just before we go to the next call, Renee, Emma Mantle has texted in or WhatsApped in to say, hi, I missed the name of the product Dr Renee said she uses for gut health constipation on a previous call. Simprove. How do you spell that?
Simprove.
There you go, Emma. Simprove. We're here to help. Let's move on. Let's go to Robbie in Roehampton. Hello, Robbie.
Well, it's not Robbie, it's Martha. He's a very good friend. Robbie's listening to you right now next door.
Ah. Hello, Martha.
Hello, how are you?
I'm good.
Thank you very much for having me.
How can I help?
My question is, he's obviously my best friend. He got diagnosed not long ago in March with cancer.
Oh, I'm sorry.
And now he can't walk as well because his legs are very swollen and he can't move, obviously. And he's been described by his GP a few days ago with depression tablets.
Okay.
I've also got a note. So what was your name again?
Martha.
Martha. I've got a note here, Martha, saying that your friend Robbie also, he can't walk, but he can't see either. Is that right?
Yes, that's true, yes.
What kind of cancer has he got, Martha?
He had cancer in his tongue, on the left side of his tongue.
Okay.
He's been getting treated, and then he became very unwell. He got been taken to the hospital a few weeks ago. They tried to help him out. They sent him back home, and today we had the ambulance at home again, saying that, you have to go back because of, obviously, you're not feeling too well. Which in himself, he's feeling okay. But, I just realised today, I've looked through he's taking steroids, and then I've seen today that someone subscribed him depression tablets.
So what's the question, Martha?
Is he allowed to take the depression tablets? Why did they prescribe him depression tablets?
So I don't know, Martha. I'm not his doctor. I don't know his history. No. I mean, people that have cancer or serious diseases quite often are quite depressed. Whether or not antidepressants will actually work for them is another matter. But there must be a reason that his doctor has prescribed them, and,
But what? Sorry to interrupt, but why would someone with cancer of the tongue not be able to see or walk?
I don't know.
Why is that, Martha? Do you know?
I think everything just come at once.
Yeah.
His legs are very, very swollen. He's waiting for an appointment to go and see the doctors. And
Poor guy. How old is Robbie, Martha?
Robbie is going to be 75 this year.
Okay.
He listens to you every day from morning to evening.
Does he? Well, Robbie, listen.
Say hello to him for me, please.
Hello, Robbie.
Hi, Robbie. Good to see. Good to have you listening. Good to have you tuned in. And I guess look after yourself. All the best. Anything else we can do for you, Martha? Or how can we? Anything else we can help with?
I think that'll be it. Thank you so much, guys.
Well, thank you both for ringing in. Thank you, Martha, and thank you, Robbie, for listening. Thank you.
It's good that Robbie's got a friend like that, though.
Yeah,
isn't
it's
it?
lovely, actually. I really like that. Now, we're going to go international now. She's a regular caller. I haven't spoken to her for a while. She's in Michigan, USA.
It must be very late there or very early.
What would it be? They're behind, aren't they? Yeah, early.
Oh, no, early. No,
not that early.
afternoon.
Not that early.
Okay.
Hello, Cindy. What time is it in Michigan?
It's 3:52.
Yeah, there you go.
Okay.
You didn't have to be that accurate.
It's the right time.
How are you doing, Cindy? Good to talk to you again.
I'm doing fabulous. I love your show. I watch you just so religiously. And Dr. Renee, you're the bee's knees. I love how you stand up for women. You are brilliant. And you know what? You hold the line when it comes to this. And that's the most important thing, especially during these woke times. You got to hold the line, and that's what you do. None of this pronoun
None of it
stuff, okay?
You know
none
what,
of it,
Cindy?
and I have none of it either.
Cindy, I've got a 6-year-old girl, and I'm going to defend her like a lioness.
Oh, that's right. No men in our changing rooms. No way.
Right, you want to talk, right, Cindy, you want to talk about the menopause, right? So ask
Yes,
Dr.
I do. Yes.
Oh, I love questions on the
I do.
menopause. Fire away, Cindy.
Yes. Okay, so I'm 52 years old, and I have a male GP. So I'm wondering, is there a certain blood work that I should have him do? You know, I've asked him, and he's very just dismissive, kind of.
No, so the answer is actually
no.
no.
He's a typical man. So
No, he's not. He's actually right on this. So if you're not taking HRT yet, or you don't want to, then there's no.
Should I be, or what is HRT? Like,
Well,
how do I know?
Let me just finish. So if you're not taking HRT, which it sounds like you're not, you don't need any blood work because you will be, as all women are at this age, deficient in oestrogen. And that's what puts you in the menopause once your ovaries stop working. And it's the lack of oestrogen which actually gives you symptoms of menopause. So hot flushes, dry eyes, painful sex, putting on weight round the middle. There are so many symptoms. Tinnitus. I mean, it's endless.
I have some of those symptoms. Mm-hmm.
Right. So there are two ways of actually tackling it. You could actually try and add to your diet phytoestrogenic foods and supplements, or you could also have, or on its own, HRT, hormone replacement therapy. So that's a combination of estrogen and progesterone if you still have your womb. You can have estrogen on its own if you don't have a womb. And the benefits of that is that your bones actually start to deteriorate quite rapidly at menopause, and HRT stops that. There's good data now to say that it actually staves off dementia, because women get dementia twice as often as men. And it protects your heart. Women get their heart disease after menopause unless they take HRT. So those are the benefits of taking HRT. Once you're on HRT, then you do sometimes need bloods to make sure that the dose is right for you. But other than that, no bloods needed before starting.
All right, Cindy?
Okay.
Told you this was my area.
Thank you.
There you go, Cindy. All right, Cindy, well, you keep tuning in, you keep calling in. It's good to talk to you.
Cindy, if you go over to my YouTube channel, Dr Renee Hoenderkamp, I've got great videos on the menopause explaining this.
All right, Cindy?
YouTube?
Yeah.
Yeah, she's on Instagram.
And YouTube.
And YouTube, yeah. All right?
Thank you so much.
Pleasure.
Great to talk to you again, Cindy. Be in touch. Keep in touch. That's Cindy in Michigan, USA. We've got
the Americans are very uplifting, aren't they?
Well, Cindy's very upbeat. She calls in quite regularly. Just very quickly before we can just about squeeze in a last call, but they haven't put a name on this, but it says, Dear Dr. Renee, I spoke to you 2 weeks ago about my lymphedema. I have now been discharged from the hospital and had funding for RAPS refused. I now feel there is no light at the end of the tunnel. Don't know what to do. Just wanted to update you and thank you for listening to me.
No, I actually did look into this and I was waiting for this call. So there's an organisation called lymphedema.org, which is a support network where it can give you all the information on how to handle this kind of thing. So go there, please, have a look and good luck.
Yeah, you put your name on there. I mean, I'm sure...
I remember the call.
Yeah, I do too. I just can't remember your name. So, thank you. There you go. There's your answer. We've got a time to squeeze in a last call, and that's from Isabella in London. Hello, Isabella. Talk to Dr. Renee.
Hi, Isabella. How can I help?
Hi. I wanted to just raise awareness of and also express some frustration. I've got something called, I'm sure you'll know, hypoparathyroidism.
Yes.
And I had that from thyroid cancer surgery. And the thing that has really been, and I've had this for 2 years now because I had my surgery 2 years ago, so it's permanent, I think, at this point. The thing I find most eye-opening about it is that I have to explain to every single GP what this is, and because you see a new GP all the time on the NHS, that's a lot of, explaining, and sometimes it feels like I'm not getting the right test done, and I'm on alpha-calcidol, this particular medication, and I've still got symptoms, and yeah, I just wanted to
do you know what? I'm really pleased that you've raised this, and this is something I may cover in one of my Instagrams, because I don't have a thyroid, and I was really worried when I had my surgeries that I might affect my parathyroid cells, but luckily I didn't. So I really feel for you, and it's a really serious condition, and I'm really sorry that you have to explain it to GPs. I really am. And I wish you luck in the future.
All right, Isabella.
Yeah, that'd be great.
All right, well, look after yourself. Thank you very much for ringing. Keep in touch. That's Isabella in London. Well, that about concludes it for another fabulous week of Call Dr. Renee.
Very quickly.
No, we got time. We've got a minute.
You remember the lady that called last week about her ampullary cancer?
Yes, I do.
She asked about prognosis.
Yes.
This is the answer. The oncologist can answer it for you, but because you're 10 years post-surgery, I would say that you did as well as you could possibly do, and the outlook is really good, because it depends on how soon the cancer was found, how much it had spread, and it sounds like yours was caught early.
There you go. Again, another name I can't remember, but thank you for ringing, and there's your answer.